want to say good evening to everyone. And welcome to your North County Community Meeting for Florida Healthy Babies. I'm Gail Johnson, and I'm going to be moderating this evening. And I just want to do a little bit of housekeeping for everyone and the mothers. There is a restroom right outside this door. So you'll make a left and a right, immediate right. Probably you'll just go straight across if you go out the back door. Also, we welcome mommies and babies. And if the mommies need some help and some of the babies, if they get a little fussy with what's going on here, we do have someone to help us with that. All right, so I'm going to turn it over now to our leader.
Well, good evening, and first thing I want to do is thank all of you for taking time out of your day to be here. For us, this is an important event. I want to say thank you to the community members because this meeting is really about you, and it's our opportunity to get some feedback from the community, and we're really wanted to target new moms, expecting moms, because you have the experience and the knowledge from our community to help inform us as we move forward. I also want to recognize and thank our agency members that are here, and you'll hear from them a little bit later. Also Dr. Washington Hill, who will be speaking tonight. We appreciate your presence as well. And then our panel members. We have some panel members here that will participate and add to the discussion. So, Florida Healthy Babies. We throw right up there right away the infant death and life expectancy slide, just so we have a frame of reference in terms of discussion. And that's an important item because infant mortality, which is the term we use a lot, is often used as an indication of a community's overall health. So basically, when we look at the data on infant death rates in our community, it can be a key indication of the overall health of our community. It can also be a great indication, as we tease that data apart, about what's going on in our community in the white population, Hispanic population, Black population. And so it's just a general indicator. So I wanted to start out with that, and that kind of leads into our Florida Healthy Babies initiative. In the fall of 2015, so not very long ago, the Department of Health statewide established a Health Equity Program Council. That council is made up of local health officers like myself from counties around the state that have an interest in health equity issues. It was established primarily so that the department could begin to examine through a health equity lens, if you will, its own policies, and what we're doing across the state to improve health for our communities. It also is an opportunity for us to provide input statewide to plans and policies and to help determine where our best practices are and share those across the state as we address health equity. The first focus area for the Health Equity Program Council is the Healthy Babies Initiative. We chose that again because it's a key indicator of overall community health. And it's an area that we don't get a lot of arguments in terms of people asking, why are you doing that? Why are you focused on that? Because everybody cares about babies. The department has invested about $1.4 million statewide to encourage all counties to work in this area with the Healthy Babies Initiative. And as we move through that program, you can go, and I'm not reading the slides, so do that while I'm talking. As we move through the Healthy Baby Initiative, it really has three key elements: the data analysis, the community meetings, and the action planning. The data analysis is, for us, is a review of all the available local data on healthy babies. So not just mortality rates, but breastfeeding rates and anything else we can capture data-wise about how our babies stay healthy. So we have already done that analysis. The next piece is the community meeting, which is tonight is the first of two meetings we're having, one here in North County, and then we'll have another one down near Northport to try to capture information from the southern end of our county. And the purpose of these community meetings is sort of as I indicated in the introduction, to hear from new moms and expecting moms in our community, what their experiences are, where they saw barriers to accessing healthy lifestyles or healthy care for their children. And that information is really important to us. We want to, as we go through this meeting tonight, we're going to talk about health equity, mainly focused on infants, but some in broader terms. And we'll also include a short screening from the film documentary called Unnatural Causes. Has anybody here seen Unnatural Causes? No. So this is a documentary. It's been out for about 10 years, and it examined health equity issues across our nation. I tell you that it's been out there for 10 years because as you see the short film segment, and we pulled it from a chapter called When the Bow Breaks, which is focused on infants, you'll see or hear some data that you think, well, that doesn't exactly fit. Well, remember, when the documentary was made 10 years ago, our nation has changed a lot in terms of how it looks between then and now. But the precepts and the things that we're discussing still apply. So I think it's helpful to set the stage for our discussion to get people thinking differently than maybe you thought before about health equity and what impacts health of our populations. When we finish going through that, then we'll share with you some key highlights of the data analysis that we did on Sarasota County, and we'll talk about that. You know, one of the good news things is in Sarasota County, our infant death rates, infant mortality rates, which remember are those deaths per 1,000 live births in a geographic area. That first number should be put up there. So our rates are about 5 per 1,000, which is relatively low. It's lower than the state average of 6 and lower than the national average of 6. So while we celebrate that, we all know that even one death is one too many. And when we really tease apart the data, and you'll see that later, you'll see and understand that there are some inequities in our infant data that crosses racial lines. And so one of the things we want to do tonight is understand why is that, and what can we do as your local health officials to try to impact that in a positive way and make changes. So as we move through this and share the data, you'll be asked to help provide potential solutions, your experiences, and we want to capture as much of that as we can. We can go to the next slide. From a national perspective in general, science knows that the higher your education level, the higher your birth outcomes should be. What scientists discovered when they looked at data nationally is that, well, I've got to get the 5-minute sign, I talked too much. When we look at data nationally, we understand that for African American women, regardless of their education or income, they had higher rates of preterm birth and higher infant death rates than white women who had not even completed high school education. And then when they compared that to black women who immigrated here from other countries, they lagged behind as well. And they did that to try to look at, is this a genetic thing or is this an environmental thing? And so it looks like it's an environmental thing. And again, this is out of that documentary film. But it makes you begin to think, why is that, and what can we do about that? So next, clearly, some of the factors that are involved in impacting birth outcomes are related to our environment. And when we talk about environment that impacts health, we mean economic status, social status, access to general health care services, access to healthy foods, safe neighborhoods, access to an environment that encourages healthy lifestyles. All of those things impact us from the time we're born until the time we die, not just during the 9 months of pregnancy. And so they all create stress in our lives, as does racism, and that's documented as well in this film clip that you'll see. And when you put all those chronic stresses together, clearly in many ways they impact the health and birth outcomes of our population. So that's just something to think about, and again, you'll see more in the film clips, and then we'll talk about that. One final definition, and then I'll sit down and we'll start the film clip, I think. Okay, there we go. They'll talk about systematic racism in the film, so we thought it was good to put this definition up here before the film starts. And again, it's talking about the systematic distribution of those resources to benefit one group of people while excluding other groups, and the impacts those have over the lifetime from a health perspective on populations. So health equity is not about making everything equal, it's about making sure that everyone has the opportunity for a full, vibrant, and healthy lifestyle. So with that, I'll let the technical experts get the film clip going, and I'll sit down. Thank you. While she's queuing that up, I should tell you, we own a copy that's authorized for public viewing of the entire documentary. It's a 4-hour documentary separated into 6 segments, and we would be happy to share that with the chats or with community groups. In fact, we would welcome the opportunity to screen the whole thing or parts of it over time and have conversations with communities. So Pascal can arrange that if anybody's interested in that for their community. Maybe we can put the mic right by it, that might help, I don't know. If we don't get feedback.
Yeah.
It's probably volume control there and not going.
Physicians in Chicago set out to solve a mystery. Why do African American women have babies that are born too small at twice the rate of white Americans? Richard David and James Collins are pediatricians who specialize in the care of infants who come into the world too early or dangerously underweight, and often both. Like virtually everyone in their field, they were troubled by the striking racial differences in rates of premature and low birth weight babies. What could account for the differences?
I originally thought that the disparity in premature delivery was really driven by socioeconomic differences between African Americans and whites. It's well known that African Americans have a lower collectively socioeconomic status than whites, are less likely to receive college education than whites. So I thought once we corrected for that, that the gap would go away.
But Collins and David discovered the gap didn't go away.
We were very surprised to find that the gap actually widened as education and socioeconomic status improved. And then began to look at it from a bigger perspective and broader perspective, and really started to realize, well, maybe it's something about lifelong minority status, which is the driving factor here.
There's something about growing up as a black female in the United States that's not good for your childbearing health. I don't know how else to summarize it.
So the two neonatologists began to explore whether being a member of a particular minority group might affect pregnancy outcomes, and they came up with a controversial hypothesis. What's behind the low birth weight and premature birth for African American babies is the unequal treatment of African Americans in American society. In other words, racism is taking a heavy toll on African American children even before they leave their mother's wombs. It's an idea that's slowly gaining acceptance.
We're in the midst of a paradigm shift. 15 years ago, racism as a risk factor was almost never heard of in the scientific paper, whereas now it's much more a possibility.
The story of Kim Anderson, a successful Atlanta executive and lawyer, illustrates exactly what David and Collins are talking about. We know that a healthy lifestyle should lead to a healthy baby. Women who eat well, exercise, get prenatal care, avoid alcohol and drugs and cigarettes, are more likely to have a good pregnancy. But one of the best predictors for a healthy pregnancy outcome is higher education.
This is a picture of me in May 1984 when I graduated from Columbia Law School. I'm living the American dream, a lawyer with 2 cars, 2.5 kids, the dog, the porch, a good husband, great family. I've always been lucky to have good health. Always ate well, exercised, never smoked.
So when we look at Kim Anderson, a well-paid lawyer in good health, we would expect her newborn to be a healthy, full-term baby. It didn't turn out that way. Back in 1990, when she was pregnant with her first child, Kim went